Record. Okay. All right. So we are going to talk all things urinary urgency. So first of all, let's talk about what is normal bladder behavior, which is there's a wide range of normal. Everybody has their own kind of norm, but in general, we should be peeing about 6 to 8 times in a 24-hour period, or every 2 to 4 hours on average. Some research says 2 to 3, some research says 2 to 4. So anything in that range is considered normal for urination. So you should not be peeing every hour, every 30 minutes, regardless of fluid intake, regardless of really any sort of reason. No matter how much water we're drinking and whatnot, our bladder should have the capacity to hold urine for at least every 2 to 4 hours. Also, it's normal to have a calm urge when you feel the urge to pee. You should not feel like I have to pee and now it's immediate, like I have to go now or I'm going to pee my pants, or that you can't focus and do anything else. You should be able to put that urge off if needed. It should not feel really urgent. Also, waking 0 to 1 times a night, which honestly, you shouldn't be waking up really at all if you're younger than 65, but 1 time a night can be normal in some individuals. That is considered normal. So if you're waking up more than that, that is something that we definitely help for. And it's can be really distressing because sleep is like everything. Okay. So, how does urgency even work? So, our urge system is really cool, and we're going to nerd out and look at the anatomy model a little bit, of course. So, here's the female pelvis. All right. And female pelvis. Can you see this? Let me go here. All righty. So, our bladder sits right behind our pubic bone, and it is really connected to our pelvic floor. So we're going to talk a little bit about the bladder. So how do I feel like I have to pee? So basically inside our bladder, do you see how the bladder is red? So just like in the anatomy model, all the pelvic floor muscles are red, and that's because it's a muscle. So our bladder has a muscle called your detrusor muscle, and it surrounds the bladder. And that muscle, a lot of us think when we go pee, our bladder is relaxing. Actually, our bladder is contracting. Your detrusor muscle squeezes out your urine, almost like if you were icing a cake and you needed to get the icing out, we squeeze the icing out. That's what your detrusor muscle does for urine. So what happens when we are filling our bladder with urine? It's constantly happening in our body. So we're always getting stretched out. And in the detrusor muscle and our bladder lining, we have these things called stretch receptors. So these are little messengers that sit in the bladder that once the bladder gets filled to a certain point, it sends a message to your brain and it says, yo, we got to pee. So when the bladder stretches though, and you feel that first urge, it's actually only 40% full. So let me say that again. That first urge that you feel to pee, your bladder is not full. It is usually at 40% capacity. The bladder can hold about 2 cups of urine. So that does not mean if you drink 2 cups of water, it just goes right to your bladder, but we can hold quite a bit of fluid in our bladder. So when you feel that first urgency, typically it is not recommended that you actually go empty. Now, when you get to about 60% full, that's when you'll feel that first like true desire that I'm going to put this down, I'm going to go pee, versus like just, oh, I maybe might have to pee soon, if that makes sense. So then when we get to that 90% full, that's when you kind of feel like I might pee my pants. It's pretty urgent right now. Okay. And that is when we do not want to empty our bladder. And I know it sounds counterintuitive, but we're going to go through that here. So when our bladder is at its kind of that 40% full, we get that first urge. I want you guys to try to think about maybe not going right away. And I'm going to give you some tips how to work with that. Okay, so how's the pelvic floor related? Obviously very related. It's the exit point of our urination system. So they play a huge role, but the pelvic floor muscles are always slightly activated. They always have some sort of contraction, which is why we aren't just peeing ourselves all the time, constantly. So they're slightly contracted to hold in our urine. But we can also use them for urge suppression and to get the urge to go down. And we're going to talk about it. And we're going to go through actually how to do a pelvic floor muscle exercises. So we can use these muscles to help with our urgency system because they are so intertwined. So what causes urinary urgency? There's a stinking ton of things and more. So dysfunctional pelvic floor muscles can give false signals to your bladder and your brain. Drinking bladder irritants, we're going to go through those in a little bit. Not drinking enough water. This is something that people are always like, what? What do you mean? I thought that would make me pee less. No, we're going to go through that in a few. Pregnancy is a time, obviously, because baby is putting pressure on the bladder. So that makes you feel like you have to go more. And the bladder can't fill as much. So you feel that urge more quickly. prolapse, taking diuretics or drinking and eating diuretics or some medications, a poorly trained bladder. So some of us have developed these habits since childhood. So we actually just have been told to pee as frequently the second we feel an urge. So now our bladder just feels that all of a sudden. Constipation can actually lead to urinary urgency. In males, an enlarged prostate can cause urinary urgency. Urinary tract infections obviously typically lead to urgency, obesity, IC, and many, many more. So let's dive into some of this stuff. Okay. Everyone thinks I'm the fluid police, and I laugh because I love all the things, but fluid is something that I think we all are like, oh, I know, lady, like I know I got to drink more water, etc. But general recommendations for good bladder health and reducing urgency is to drink half of your body weight in fluid ounces per day. So if you weigh 120 pounds, you need at least 60 ounces of fluid, 60 fluid ounces of water per day at a minimum. I usually say stick to 6 to 8 glasses if you can per day. These are 8-ounce glasses. So just 1 cup is a glass of water. Try to get that in throughout the day. Now, we are talking about plain water here. I want you to try to make 75% of your fluid intake throughout the day just plain Jane water. And I know it's not fun, but it is necessary for our adequate hydration. So this is the kind of talks about the type of fluids that we drink. They have a direct impact on our urgency system. So if we have a lot of urgency, we need to really look at what we're drinking and eating, because that can be leading to quite a bit of the problem. Sometimes, like I said, too little of water could be the reason why we're having urgency. We're going to talk about that next. So it's all about concentration of your urine. So the more concentrated your urine is, the more likely you are to experience increased urinary urgency, frequency, and incontinence and leaking. So it's really common to think that if you avoid drinking water or decreasing your urgency, or drinking water will decrease your urgency and leakage because you're not drinking enough fluids, but that's actually really false. Hydration is crucial for your bladder health. So hydration, drinking enough water actually makes your urine less concentrated, leading to it not being as agitated. So when we have highly concentrated urine in our bladder gets signaled to get it out. It says it's yucky. It wants to get it out. So it'll send you increased urgencies, frequencies. You'll feel like you have to go more because your bladder contents are more irritating and more concentrated. So the step one to reducing urgency is to make sure that our bladder lining is not irritated through what's inside our bladder. So increasing your water intake is one of the first things, but we want to do this gradually. So if you are not drinking enough water, you're not getting anywhere near your half your fluid ounces per day, don't all of a sudden just start drinking half your fluid ounces per day. Try to increase by maybe 1 cup and then slowly over a few days, then to the next cup, to allow your bladder time to learn to accommodate for its new fluid. So let's talk about irritants. There's a lot of them. All right. So everyone's like, oh no, don't take my coffee away. And I promise you, I'm not. These are not bad for you necessarily, but these are common foods and drinks that irritate our bladder lining and make us feel stronger urgencies and frequencies. So alcohol, we all kind of can, if you drink alcohol, know that typically when you drink alcohol, you feel like you have to pee more and like to break the seal, blah, blah, blah. Caffeinated beverages, coffee, tea, sodas. Actually, even coffee and tea that is decaf can actually irritate your bladder lining as well, because it's decaffeinated, it's not uncaffeinated. Also herbal teas, just because they are, if you think about it, your water changes a color because it's adding substances to the water that can in turn irritate your bladder lining. Carbonated beverages, even carbonated water like LaCroix, any sodas, any sort of anything with carbonation can irritate your bladder lining. Artificial sweeteners, milk and dairy products, spicy foods, acidic foods such as citrus juices, cranberry juice. I know everyone thinks it's good for UTIs, but that can actually irritate your bladder lining. Orange juice, tomato-based products, chocolate, so sad. Vitamins B and C, and cigarette smoking. So these are irritants, right? But they aren't that bad for you. There's plenty of healthy things that are in this, but there are some things that are mega irritants, like a soda. A soda is carbonated, it has artificial sweetener in it, and it also has caffeine. So that is like a mega irritant to your bladder. So there's no wonder that when you drink sodas or alcohol or mega irritants, that typically you'll feel that increase of urge to urinate. So it's not that you can't have these. There's some techniques that we can do to make these less irritating on your bladder. my arrows don't work, so I have to use my thing. All right. So bladder irritants, like I just said, affect everybody differently. Honestly, I see some patients who can drink like a pot of coffee and never feel like they have to pee, but the second they drink tea, they are in and out of the bathroom every 30 minutes. So you really got to see what irritates you specifically and you only, because we are all very, very different. Just because something is on that list does not mean that it will irritate you. You just have to try for yourself. So I recommend do not like eliminate everything at once and then see. I would say try to take away something or reduce the amount of something and see if that makes a difference for you. If you do too many things at once, it's kind of hard to know what helps and what hurts. Now, this is where I come in. I love my coffee in the morning. My goodness, it is like my saving grace. So many of us do. And it does not mean just because it's irritating and you're experiencing urgency that you can't have these things. But there's a thing called a coffee sandwich or an irritant sandwich that you can do to help reduce the irritation that these substances frequently bring on your bladder lining. So what we recommend is having a little bit of water before your irritating fluid and after. So you sandwich the irritant in between. So first thing in the morning, what I do before my coffee, I have a glass of warm lemon water to help kind of dilute some of the irritants I'm about to take in my bladder. Then typically I'm not running to the bathroom every 5 seconds. So if you can kind of increase that water around some of these irritating substances, it can reduce their concentration. Then that makes your bladder lining not as irritated. So drinking a glass of water between glasses of wine can be helpful. Also, if you do want to drink like a Gatorade, drinking water before and after that, some people like to actually physically dilute it. That can help how irritating it is to your bladder lining, which in turn reduces how strong the urge to feel to urinate is. There's some other tips to kind of sneak it in the water. So to make sure that you're getting in that kind of large amount of water per day. A lot of times I have patients take a glass of water with like right after or before brushing their teeth. That gets one in, and one with every meal. That's usually about at least 3 in. So you're at 4. You really only have 2 more to get in throughout the rest of the day. So typically pairing a glass of water with something that you regularly do each day helps with compliance and helps you just kind of be better at getting it in. Now, the thing is, you don't want to chug your water. So it's more important to gradually sip water throughout the day than it is just to get all those fluid ounces in. So I'd rather you get like 50 ounces of water in versus chugging 100 ounces, if that makes sense. So try to keep your water intake throughout the day. That helps make your urine less concentrated and help really reduce the irritation. Another quick test is just to look in the toilet after you pee. It should be a pale, pale, pale yellow, like almost clear. That's how you know you're adequately hydrated and minimal concentration. So the good news is you can retrain your bladder. Your bladder can learn, and that's super cool. Sometimes we've trained our bladder to do a lot of these things. We can also untrain it or detrain it, whatever the word is for that. Okay, so there are these things called urge suppression techniques. These are techniques that help you suppress the urge to urinate. So a lot of times we've done some of these things without actually knowing that we're doing it. So a lot of times I'll hear people are like, I went to the grocery store and then I saw something I needed, and next thing you know, I never even peed, or I got on a phone call and I didn't pee. That is an art of some urge suppression techniques we're going to go through. But what you want to make sure that you do is you do not urinate when you are having a strong, strong sense of urgency. So even if it's been like 4 hours and you really, really have to go, you want to make sure you get your urge calm first, then go to the bathroom. Anxiety really makes it a lot worse. And also, we are not supposed to empty when we're in an anxious state. So our nervous system has 2 different sections in our subconscious nervous system. So we have our parasympathetic, or the rest and digest, and then we have our sympathetic, which is the fight or flight. Anxiousness gives our fight or flight system a little bit of a ramp up. And actually, in our fight or flight system, we are not supposed to be urinating. So it really confuses the brain and can cause a lot of your urges to be trained incorrectly to where it feels like an anxious thing each time. So we want to encourage our body to be in the rest and digest nervous system when we're urinating. We want to rest in the restroom. So if you do feel that really strong urge to urinate, you want to get it calm, then go. So that is one of the first things that I want you to focus on. Now, these are all things that we can do to help get that into that calm state. So we are going to go through all of these, and I'm going to teach you how to do kegels and diaphragmatic breathing today. All right, you ready? So how to properly do a kegel. I can't believe I'm saying this because I cannot stand kegels, but Kegels actually set off a reflex in our bodies that helps suppress the urge to urinate. It helps decrease activity of your bladder muscle. So we can use Kegels to help suppress urgency. Now, 5 to 10 of these is pretty much all you need. And it's really, really important that you do these properly, which is why I usually recommend you seek out help from a pelvic floor therapist so that you know, because up to 80% plus of people do not know how to properly do a Kegel. And so doing these properly for urge suppression is really important. But we're going to go through it so you can just try and see if this works for you with urgency. So if you are not, go ahead and get to a seated position. And I want you to put your feet flat on the floor. Okay. Now I'm going to bring back the anatomy model. So picture all these muscles in red. See, there's a lot of them. Okay. Now I want you to picture your rectum in your vaginal area, or possibly just your rectum if you're a male. And I want you to think about this area sitting on the chair. Okay. Like this. Close your eyes. Can you feel that area? Now, I want you, this is a very small movement. Try to act like you are going to hold it in gas or stop the flow of urine. It's a really small movement. Some people also describe like imagining a blueberry at the anus, trying to lift the blueberry up. And the most important part of this is putting it back down. So making sure you don't hold that Kegel state. You want to squeeze slightly and then let it go. So if you can open your eyes, see on the camera, you want to think about squeezing and letting it go. What you don't want to feel is your tummy really gripping, your butt cheeks clenching, or holding your breath or pushing out. That is incorrect. We want a really small movement, imagining like you are holding in gas or urine, slightly elevating the anus and vaginal area, like you're picking something up and then putting it back down. So that's how to properly do a Kegel. It is not a big motion. It is not a butt clench or an abdominal action. So if you're having a hard time, don't worry. I definitely recommend seeking out help from a therapist, especially if you're dealing with urgency symptoms. That is going to be the best thing for you. But doing 5 to 10 of these Kegels when you have a strong urgency suppresses that urge and makes it in a more calm state. So that's one urge suppression technique that you can do. The next one I like a little bit better. It's going to be diaphragmatic breathing or deep breathing. So let's go over how to do that. So same thing, get in that nice seated position. I want you to take your hands and bring them on your ribs. And if your shoulders are like this, I want you just to let it go. Good. Now, I want you to think about, as you breathe in, your rib cage going outwards and your abdomen going outwards. Almost envision like all 360 degrees of your body expanding with your breath in. What you don't want to do is breathe through the chest or your neck muscles, or just breathe, poke out your lower belly. We want to think about that rib cage really expanding. Now, what that's doing is that helps relax the pelvic floor muscles. And I know that sounds weird when you feel like you're about to pee, but I promise you this helps calm down the urgency. So if you feel like you really got to go, I want you to think about doing diaphragmatic breathing. So bring your hands to your ribs, take a breath in through your nose, think about your rib cage going outwards, and exhale. Breathing outwards and exhale. So with that strong urgency, doing deep breathing can calm it down. So really thinking about expanding and letting it go. That also helps you get out of that anxious state, like you're going to pee your pants as well, but it also affects you at the muscle level. Okay. Now let's talk about the art of distraction. So if you've experienced this before, where you felt like you had to pee and then you got distracted and then forgot, and then you feel like you have to pee again, we actually have the ability to send off urgencies. It's okay to do this. We don't want to do this all the time, and you want to empty your bladder when it's full. If you don't want to be holding your urine longer than 4 hours, that's actually causes other issues. But if you are in the middle of something, you should be able to have the urge to, or the ability to put off that urge. Your bladder does not control you. You control your bladder. Okay. So the art of distraction, if you can, I want you to sit down, or think about maybe if you have a game on your phone, pull out the game, play the game. It's your one time you're allowed to. Also, a lot of people will start thinking about like every state they've lived in, or they'll count backwards from 100 by sevens, or maybe start trying to list every capital in the United States, something to get your mind off the fact that you have to pee. So distract yourself. And once that urge is calm, if it's been within 2 to 4 hours, then go to the bathroom. If not, just let it pass by. It's okay to distract and ignore that urge to urinate. So we want to get that urge down, and distraction is one of the best ways, and it's one of the most effective, quick ways as well. Also, pressure to the perineum, which is this area in our kind of in the vulvar area. So pressure, that's why you see little kids do the pee-pee dance. So I'm going to show you here. You can bring your hands, apply pressure to this area, or sitting down also applies pressure. That helps suppress the urgency. So you want to hold that there until that urge calms down. Do not panic if you feel the urge to urinate. If you feel like you're going to pee your pants, panic and anxiety increases the urgency. So it just makes it worse. So try to think, I'm going to do my urge suppression techniques. I'm going to do some kegels. I'm going to deep breathe. I'm going to put pressure. I'm going to distract myself and try to get that urge calm before you go. Sometimes it's like a mega urge. You have to do like a million of these things, and I promise you that it will subside. So it's kind of like a bell curve in good old statistics class. You kind of get to the peak and you feel like you're really going to pee your pants, and then it goes back down. We want to pee when it goes back down and when it's in a calm state. Hope that's making sense. And also that you are feeling more confident with your ability to control your urgencies. Okay, so bladder retraining. So this is when I typically recommend that you definitely should see a pelvic floor physical therapist, because it's super specific to you. We have you track on a log. We really go into depth exactly what's going on for your specific situation. But in general, when we can retrain the bladder by slowly increasing our intervals of our urination. So what I first usually recommend people do is don't even worry about like just all of a sudden trying to hold your pee for 2 hours. Like, please do not do that. If you're going every hour, don't all of a sudden be like, I got to hold it because Kat said like 2 to 3 hours is normal. No, we want to meet you where you're at. So my first goal for you is to just start practicing getting in control of your urgencies. So maybe for the next week or so, you just start practicing when you do get that really strong urge, just calming it down and then allowing yourself to go, even if it's every hour. So just trying to get yourself in control of that urge so you feel less likely to leak or maybe have that urgency. Once you feel like you are able to control your urgencies, then slowly start to increase the time. So if you're going every hour, maybe try to hold it for an hour and 5 minutes, an hour and 10 minutes, an hour and 15, an hour and a half, and slowly work towards that 2 to 4 hour time frame. You can even do 1 minute. It doesn't have to be 5 minutes or anything. Just slowly increase the time between voiding. So also, a good way to do this is just to know, just remind yourself that that first urge that you feel, your bladder is only like 40% full. So just know my bladder doesn't need to be empty. We only need to empty your bladder when it's pretty much full. So you can tell yourself to have that confidence and then slowly start to space those sessions out in the meantime. But for real bladder retraining, I would seek out help from a pelvic floor therapist just to make sure that it's really specific to you. But you can try these things. These are really helpful. Okay, nocturia. What is nocturia? So this is nighttime peeing. So if you wake up more than one time a night and you're younger than 65, you are considered to have nocturia. So we should not be waking up to go to the bathroom. And I really challenge you to think, are you peeing because you woke up with the urge, or did you wake up because maybe your partner moved in bed or your dog woke you up and now you're like, I'm awake, I might as well pee. So there's two different ways. Usually if you're getting awoken by the urge to urinate, it's a little different, and we want to really work on that. If you do get woken up by your dog, your partner, or some noise or something, try to fall back asleep. Try not to get up and go to the bathroom. So some things that you can do to help with nocturia is you can cut down your fluids about 2 hours before bed. Try to avoid any of those irritating fluids. A lot of people do like sleepy time tea. That can be a big one. Or they'll have ice cream before bed, and that's dairy. So that can really irritate you. So really look at your nighttime patterns. Some people take medications at night that are diuretics that can increase your urine output. And then alcohol is a big one. Alcohol can also increase your urine output. So you're feeling like you need to wake up and go more. So usually I say reduce fluids about 2 hours before bed if possible. All right. Now, another little technique you can do is just lay and turn your feet around and put your feet up like an hour before bed, either on the couch or something. This allows for really good venous return and allows you to urinate before bed, and having not any excess fluid from standing and working throughout the day is a really nice little trick to do. And also practice your urge suppression. So if you wake up at night and you feel like you have to pee, I know, but I want you to try to fall back asleep. Usually I say start with deep breathing since you're already sleeping. Say, I don't have to pee. I'm going to fall back asleep. Your bladder can actually hold double the urine at nighttime. So I really want you to remember that you do not need to be waking up. That can really affect a lot of other things if you're not getting good sleep because of your waking to urinate. So really try to think about doing those urge suppression techniques. Some people who wake up 3 to 4 times a night, I say don't try to all of a sudden not wake up at all. Try maybe to get, if you're doing 4 times a night, to 3 times a night, to 2 times, to 1 to 0. Okay. If you are pregnant, older than 65, or have another underlying condition, a lot of times, sometimes waking up more than once can be considered normal. So these are general bladder habits and tips that are nice to your bladder and healthy. So we kind of went through a lot of these, but one of them ones that we haven't talked about yet is limiting your just in case pees. So what are just in case pees? So a just in case pee is anytime you go pee without having the urgency, but just in case you might have to pee later. So a lot of times before leaving the house, we'll pee just in case. A lot of times we'll also, like, you see the bathroom at the grocery store, like, just in case, I might as well. Or maybe you're about to go work out, might as well just pee just in case. So doing that really confuses our brain and bladder's connection. Our bladder is supposed to empty when it's full. So if you're emptying it when it's not full, the bladder and brain will start giving you false senses of urgency. You're not letting it truly expand and deflate, I guess you could say, properly. So the more you just in case pee, the more you're training your bladder to feel more urgencies and frequencies. So try to avoid those as possible. Sometimes that you can't, like if you're going to be in like a 3-hour meeting, sure, go pee, or you're going to be on a really, really long road trip, go pee, or some other restriction. Those should be really minimal though. You should not be frequently doing this. Okay. Also, like we said, drinking water throughout the day, don't chug, slowly drink throughout the day. If you do feel a strong sense of urgency, use those suppression techniques to get it under control in a calm state, then go to the bathroom. Now, these are a few other ones. Do not hover over the toilets. So hovering does not let your pelvic floor muscles relax properly. It can lead to incomplete emptying. It can lead to a lot of problems. Also, there's some sort of germ stuff too, if you read up on it, of hovering. That's not so cool. But from a pelvic floor muscle standpoint, hovering really does not allow for your body to fully relax. So I encourage you to sit. If you need to if you're in public, make a toilet paper little cocoon over the toilet, do so. But sit down, try to rest and breathe. Don't push your pee out. So pushing your pee out puts a lot of pressure on your pelvic floor. Also, it can lead to dysfunctional voiding and emptying, which can then lead to other issues causing you some urgencies. So we want to rest in the restroom. So think about that, rest and digest. Thinking about my body is relaxed, tight. Use that deep breathing that we went through to try to really empty the bladder fully. Limit your bladder irritant intake. I usually say 1 to 2 max per day, and then do that coffee sandwich around them if you want to help reduce urgencies. And then avoiding constipation. So the reason constipation can cause urgency, here's the bladder and the rectum. So these guys are neighbors in the pelvic area, in the pelvic floor. So if my rectum is full because I'm constipated and I can't get it out, it actually can apply pressure to your bladder, leading you to feel like you have to go pee all the time. So making sure constipation is a really actually commonly missed cause for urinary urgency. So if you have constipation, that could be leading to some of those symptoms for you. So making sure that we are doing really good habits. And if you want to know more about constipation, on my YouTube channel, I have a whole webinar on that as well. All right. So that kind of brings us to the end here. What questions do you guys have? I'm gonna pull up the chat box here. Give me 1 second. And no worries. Any questions about urinary urgency? Urgency before running or jumping. Really great question. So even if you just emptied, so sometimes that urgency, it can be somewhat of a anticipated urgency if that's something that's been happening. If are you asking before, like you actually even start the act, or right when you start it?
Can you hear me? Is it easier to talk?
Yeah.
So a great example is like in our gym. I know every woman, as soon as we have a jump rope workout, they run to go empty their bladder, including myself. And then, like sometimes, if it's a really long workout, especially with jumping and running, you'll see them run back to it. And I don't know, like with what you're saying, if that's just mind over matter because we are kind of distracted, or is there something? Obviously, we probably all need to come see you.
I
um,
know.
do we breathe through that? What do we do? Because I feel like everyone's kind of distracted at that moment, but still, they're still running to go use the restroom.
Yes. So a lot of times it's the act of the exercise that actually puts more increased pressure on the bladder and causes that feeling like it's needing to empty. So a lot of times that more strenuous exercise can make us feel like we're emptying because of the strain that it's acting on the pelvic floor and the bladder connection. So I do recommend if you are doing, some individuals with incontinence that they do empty before exercise, but that feeling of urgency, I would say I would actually have them stop, calm it down, relax, breathe, and then return to the exercise. Because sometimes it can be trained over time. And then also just because of that impact from the pressure, it can give that false sense.
Oh, thank you.
Yeah. Also, the pelvic floor muscles are typically really activated. And sometimes that really tightness can actually facilitate a false sense of urgency. So, if those muscles are really spasmed, they're really close neighbors to the bladder. So, sometimes, like a lot of those activities require a lot of deep core activation, which in turn activates the pelvic floor. So, sometimes it can be due to that as well. So I typically, if that is the case, like stop, take a deep breath, or do maybe take a rest, do a few kegels, breathe, and then try again. And just give your body that time to suppress that urgency.
Beautiful. Thank you.
Yeah. Great, Becca. I don't know who iPhone is, but thank you. Um, Yeah, well, I really appreciate you guys joining. If there's no more questions, I'm not going to make you guys sit on here and wait for them or anything. But feel free to even message me via Instagram. Here, I'll put this my next slide. I always forget to do this slide, but my phone number is right here. If you want to schedule an appointment or possibly any sort of inquiry or questions, you can give me a call. There's an email to access or my website. There's a contact form or on Instagram. You can send me a DM, super easy to get in contact with and answer any questions that you might have. So I appreciate you guys joining this quick little webinar tonight. And I will also post this up in the YouTube channel. If you have any friends or anyone that might benefit from this, feel free to share. I hope you guys have a wonderful, wonderful night. And you're welcome. Thank you. All right, guys, have a great one.